Scanal, Sego, and good day, Six Nations. I come to you today before the long weekend with urgent messaging regarding the current COVID-19 situation on Six Nations. In the past 30 days, we have had 41 new positive cases of COVID-19 within our territory, and that number continues to rise. As I speak to you today, we are currently sitting at 19 active cases, and there are likely more that have not yet been reported. Again, as we go into the Labor Day long weekend, I want to stress the seriousness of this situation to our entire community. The COVID-19 virus that is going around now is not the same as the virus we dealt with at the same time this time last year. Of our 19 active cases, 9 of those are confirmed to be the Delta variant. The Delta variant is significantly more dangerous than the original strain of COVID-19, especially to unvaccinated people. Statistics show that the Delta variant is easier to catch, spread, and causes more severe illness, hospitalization, and even death. If we do not get our cases under control, we risk going into another outbreak similar to the one we had earlier this year. The best way to protect our community from an outbreak is to get as many people vaccinated as soon as possible. We currently only have 38% of community members who are fully vaccinated, and that number needs to be much higher. If we don't get more people vaccinated, we put ourselves, our elders, our children, and each other all at a higher risk. We need to be taking this situation seriously, especially with our children going back to school next week. Many of our children are not old enough to receive the vaccine yet, but they are still at risk of catching COVID-19. We want to work with parents and understand that some may not feel comfortable sending their children back to school at this time, which is why the current school plan is a 2-cohort system with 3 days of in-class learning and 2 days online, with the option of learning fully online 5 days a week. Six Nations is more vulnerable to this virus than other communities, as we have a large elderly population, as well as many people who have underlying health conditions that make COVID-19 more dangerous to them. So I'm asking you, if you are eligible, please get vaccinated to protect Six Nations. Ashwegan Public Health runs vaccine clinics every Tuesday and Thursday, and appointments can be booked online at sixnationscovid19.ca or by phone at 226-227-9288. The Pfizer vaccine is also available to children born in 2009 or older at the clinic. While getting vaccinated is the most effective way to stop the spread of the Delta variant, it is only one part of the solution. We need our entire community to come together to continue following all public health measures to avoid another outbreak. This includes avoiding crowds and large gatherings, coming into contact with the least amount of people as possible, especially with people who are not fully vaccinated, wearing a mask when around other people and even outside, keeping a 2-meter physical distance between yourself and others, washing and sanitizing your hands frequently, cleaning and disinfecting commonly touched surfaces, taking all symptoms seriously, and getting tested when you are showing symptoms or think you may have come into contact with a positive case, and as well as staying in self-isolation until you or anyone else in your household getting tested receive your negative test results. What may seem like an innocent gathering with friends or a family barbecue can easily lead to an outbreak in cases that spreads to multiple families and social groups. You don't always know where people have been, who they have come in contact with, and if they are carrying COVID-19. They could be asymptomatic and still be contagious. This applies to us as individuals as well. It is possible to show no symptoms of COVID-19 and still be infected with the virus and spread it to others who can become severely ill. Even fully vaccinated people can contact and spread the virus to others, which can be potentially fatal to those who are not fully vaccinated. This does not mean that vaccines don't work. Statistically, the severity of illness is low among vaccinated people who are infected with COVID-19. This just means that we all must be vigilant. All of us must continue to, again, follow all public health guidelines to slow the spread of the virus. And early next week, we will be re-evaluating our alert level status. Additionally, we will have more information forthcoming on a potential third dose or booster shot of the vaccine, as well as Ontario's newly introduced vaccine passport and what that means exactly for Six Nations. In closing, I know everyone is tired. I know we have been in this pandemic for 18 months and it seems endless. However, we are in a much better situation to protect one another than we were a year ago or even just a few months ago. We have been given the necessary tools we need to protect our people. We all just need to use them. So I'm once again stressing the importance of getting vaccinated. If not for yourself, then please do it to protect our elders, our children, and our most vulnerable. The core of our community and what makes us Indigenous peoples is how we protect one another. Let this pandemic be another opportunity to rise to that challenge. In the meantime, please stay safe this holiday weekend as well as healthy, and please continue to be kind to one another. Thank you, Nyawa.